I never imagined the word stage 3 cancer would apply to me, especially a kind I'd never even heard of. What is follicular lymphoma? It's a rare, slow-growing cancer that often hides for years until it doesn't. Hi, I'm Joey. I share real stories, helpful tips, and science-backed info to help cancer patients, survivors, and caregivers feel a little less alone and a little less afraid. I had been growing more fatigued over the years when suddenly I started rapidly losing weight, sweating profusely at night, was in constant pain, and growing visible lumps in my neck, armpits, and pelvis. I thought it was fibromyalgia, maybe even H. pylori, but before that I brushed it off. I thought my fading energy levels were just aging. Even doctors misdiagnosed me at first. The truth is, follicular lymphoma had been growing in my body for years, silently, until suddenly it wasn't so silent. In this video, I'm going to explain what follicular lymphoma really is, what I wish I knew when I was diagnosed, and how my treatment journey unfolded, including a few surprises. Follicular lymphoma is a type of non-Hodgkin lymphoma, and there are over 60 types. It falls under a group called B-cell lymphomas, which are cancers that start in your B lymphocytes, a type of white blood cell. There are also T-cell lymphomas, but follicular is a B-cell type. It's usually classified as slow-growing or indolent. In fact, some people have follicular lymphoma for years before symptoms show up. But over time, it can become more aggressive, and that's what happened to me. You'll also hear doctors talk about tumor burden, but it's not just about how much cancer is in your body. It's about how it's affecting you. I have what's called high tumor burden, with large lymph nodes in multiple areas and intense symptoms like pain and fatigue. To be honest, I used to believe it was infection-related. I thought maybe it was linked to chronic illness or gut problems. But according to Leukemia and Lymphoma Society and recent studies, the exact cause of follicular lymphoma still isn't known. There's no single trigger, but there are risk factors, including being over 60, having a weakened immune system, or exposure to certain chemicals like pesticides. In most cases, it's not genetic, and you can do everything right and still get it. That was a hard truth to accept. Because of my high tumor burden, I started on chemo plus immunotherapy right away. And honestly, I know this sounds wild, but I saw results overnight. Follicular lymphoma is considered incurable, but it's highly treatable and manageable. Many people live long, full lives with this diagnosis, going into remission for years at a time. Most treatment plans begin with a combination of chemotherapy and immunotherapy. For me, that was bendamustine and rituxan, and I saw results fast. My lymph nodes visibly shrank overnight, and my pain dropped the very next day in half. In those first few months, I actually surprised everyone by saying, "I love chemo," because it was working. The treatment brought relief fast. Everyone would smile, but it was true, at least for those first few months. But let's be honest, chemo is hard. After a few months, the fatigue hit like a wall. I had a dangerously low heart rate and could barely function some days. It's tough. It wears on you. Chemo is tough, no doubt. My blood pressure dropped, and I was exhausted all the time. But it's doable. And in many cases, it's incredibly effective. It was doing what it needed to do, and I'll always be grateful for that. After finishing chemo, I began maintenance therapy, and this is where the journey can look different for everyone. Most people continue with Rituxan, but I happen to be part of the small percentage of patients who are resistant to it. So I was switched to a newer immunotherapy called obinutuzumab, sometimes called Gazyva. I also take a cancer-fighting drug called Lenaledomide, also known as Revlimid. It's a type of oral chemo I take at home in 21-day cycles. This combination is designed to get me into remission again. If all goes well, I'll stay on this plan until October or November, and then we'll reassess. But just know, there are options, and if one approach doesn't work for you, another might. You are not out of options. Here's what I wish someone had told me. You'll likely be on maintenance immunotherapy after chemo ends. For me, that means 1 infusion a month, and then every other month for 2 years if I stay cancer-free. A port can really help. I was resistant at first, but I made a video about my chemo port experience because I wish I had known sooner how much easier it makes treatment. Chemo doesn't always mean hair loss. I didn't lose all my hair. Mine just thinned and grew back curly. Chemo curl is real. Your story might not match anyone else's. That doesn't mean it's wrong. It just means it's yours. Looking back, my body was trying to tell me. I was brushing off the fatigue, telling myself it was aging, stress, fibromyalgia, anything but cancer. I was misdiagnosed more than once. One ER told me it was just a stomach flu, and a natural doctor believed I was in liver failure from hepatitis C. Months later, I found out the truth. I had stage 3 follicular lymphoma. If something feels off, don't stop asking questions. You know your body best. Follicular lymphoma can feel overwhelming, but it's also very treatable. Many people live long, full lives with this diagnosis, and even if your path is more complex like mine, you're not alone. If you're newly diagnosed or deep in treatment or a caregiver trying to understand, subscribe for more personal stories, cancer info, and support. Drop a comment and let me know where you are in your journey. I'd love to connect. You've got this, and I'm rooting for you.